All right, welcome back to Pharmacist on Call, your 1 hour forum, your host, Dr. Sean Pruitt. And if you are watching this show, I am your community pharmacist. So we're going to get right back into the water here, the beauty water. So yes, as I told Ms. Cleo there, the water basically promotes the optimum environment for the skin to flourish, breaks down oil in the skin. So those who have acne or oily skin, it naturally breaks down that oil, but still moisturizes the skin so it doesn't dry it out. This water also has an astringent effect, so it tightens skin. So if your skin is loose, it will tighten it, kind of like the effect of a witch hazel. So kind of a skin tightening effect. In terms of the hair, it promotes the optimum pH for the hair to grow, moisturizes the hair, and provides the hair a nice shine. So we sell a ton of this stuff, and it's caught on pretty quickly with the women, I guess, and some men too, I will say that, simply because it does work pretty well. So that is the beauty water. Outside of our skin, slightly acidic. Back to the inside of our body, we should be slightly alkaline. Let's see, other conditions. Oh, as I talked about, like I said, depression, bipolar disorder. We have patients that are managing themselves with the water for those conditions. So a bevy of conditions, from psychiatric to dermatological to internal, in terms of different types of pain, different types of chronic illnesses. So lupus, sickle cell, I'm not so sure. I don't think we have any patients on it. And MS, we have some MS patients who are also using the water as well. So make sure you come in and get that. It's a very easy solution, produces its results very quickly. So most people who will come in and say, well, Dr. Pruitt, I hate drinking water. And that's probably 70% of our water customers. You will like this water because, like I said, most patients say it tastes like nothing. So it doesn't have the chlorine and the fluoride taste that would keep you from drinking it. And because the molecules are so small, you can drink a ton of it and absorb it. So we have patients who come from all over, Kentucky, McMinnville, people who buy upwards of 40 gallons per visit. And so we sell a ton of this stuff. It's actually overtaken the pharmacy. So that's enough on the water. The other self-care piece that is probably our second bestseller to the water is our beetroot juice. And this thing is a powerhouse because it takes care of, gosh, probably 10 to 20 different health conditions. And so the beetroot juice, I kept getting people coming by the pharmacy who were on their medication, who were on blood pressure medicines, and these were DOT drivers. So there was bus drivers, UPS drivers, FedEx drivers, and they could not pass their driver's physical. And so I started them on this to lower their blood pressure, and they all passed on just one little capful. So what this does, it lowers your blood pressure somewhere between 30 minutes, an hour, maybe a couple hours, lowers it down to normal levels. And so these were people who were already on blood pressure medicine, but the medicine wasn't doing it, or maybe they became refractory to it. So once they added, not substituted, y'all, added this to their regimen, then this was able to complement the medicine to bring it down to a normal level. And so it took off and became an overnight sensation after that. But I started getting people coming in and saying, you know what, doc, that water, it lowered my blood pressure, but man, I also noticed my diabetes is going down. My doctor said my A1C was going down and my fasting blood sugar had gone down. And so as I began to investigate, I was like, hey, this thing does also affect the pancreas. And so yes, this also lowers your fasting blood sugar for those people who are already on diabetic medication and their blood sugar still were not being lowered. Once they added this, not substituted, added this, then it began to bring their blood sugars down and their A1Cs down. And I think the largest dip I heard, Mr. Green, was 11, an A1C of 11 to like 6. And this was in the first 3 months that this gentleman began to use it. So I guess he was in between A1C says actually he did the water and the beetroot juice. So to go from an A1C of 11 down to 6 in 1 3-month period is remarkable. So great for diabetes. The other thing is it also lowers cholesterol. So great at lowering cholesterol, high in fiber. So for those of you who are constipated and not quite regular, This thing is high in fiber, because one of the chief complaints many people would say is, yeah, but it kept giving me diarrhea. Not giving you diarrhea, it is giving you a regular bowel movement cycle. So the natural fibers in there are basically keeping you regular. So people, my viewers who are patients, it's not giving you diarrhea, it is regulating you. Let's see, what else do you do? What else does beetroot juice do? Has a compound in it for those of you who are suffering from liver problems. Has a compound in it called betaine, B-E-T-A-I-N-E. And what this compound does is it detoxifies the liver and helps to heal it. So for those of you who are suffering from, I guess, cirrhosis or hepatitis, those types of conditions, or if your liver was damaged from a certain medication, maybe one of the statins, then what beetroot juice will do is detoxify the liver, help the liver clean itself, and then also begin to heal. So the betaine has dual function, detoxify and heal the liver. Also does the same for the kidney, and I forget what the name of the compound is for kidney. So for those of you who have kidney issues, beetroot juice will also help you out. So the reason I like this is because this one product deals with hypertension and diabetes and all the other comorbidities that come along with it. So if you have hypertension and diabetes, you're going to be prone to pancreas problems, kidney problems, a whole bevy of different things, cholesterol problems. And so this juice helps not only those primary conditions, but the comorbidities, the other diseases that go along with it. But it looks like we've got a call here, so I'm going to hang on a second here. Mary, welcome to Pharmacist on Call. How may we help you?
Yes, I was calling because I'm a diabetic.
Yes, ma'am.
And I'm watching the show. The beetroot juice, I have neuropathy in my feet.
Yes, ma'am.
Does the beetroot juice help that as well?
I don't know, but I do know this. Once we get your blood sugar under control, neuropathy will probably subside.
Oh, great.
What are your sugars running right now?
Between 130, 150.
Yeah, you're just slightly up there. Yeah. So we want you closer to like 110, maybe 120. What is your A1C running right about now?
It was 7.2 in July.
Okay, 7.2. So yeah, we can get you down to a 6 where your doctor wants you. He wants you closer to, you know, that 4 to 6 range.
So it's just one capful a day, or 2 teaspoons, or
one capful, and that's actually 2 tablespoonfuls.
Two tablespoons, just once a day.
Yes, ma'am. You shake it up real good. Now, some people have added a second dose just because they want to bring their numbers down quite a bit. And so it just depends on what you want to do. Some people will drink even half a glass, especially those who have anemia, because it's high in natural iron. So a lot of people, just to increase their energy, will drink more than the capful. But as far as your blood pressure and blood sugar, you know, a capful once or twice a day will get you what you need in terms of controlling your blood pressure and your diabetes.
All right, and then the last thing, I've noticed that when you said about anemia, I've noticed that I've started eating ice. Is that a sign that I may be anemic? Yes, ma'am.
Yeah, telltale sign that you are anemic. So we want to get you on this beetroot juice, get your iron levels back up, get your blood sugar down, get your blood pressure down. But also this thing, because it is a vasodilator, for those of you who are scientific, it opens up the blood vessels and allows more blood to flow through. So you would greatly benefit from that, improving your circulation.
Oh, fantastic. Thank you so much.
Yes, ma'am. You're welcome.
All right, bye-bye.
All right, bye-bye. Yeah, I guess I forgot to explain how it does its thing with blood pressure. So yes, this thing is full of organic nitrates, which nitrates cause vasodilation. So in hypertension, your blood vessels are like this. They're constricted, and your heart is having to push a large amount of blood through this little bitty vessel, and so it has to work hard, and that is why your blood pressure is high. Once you take the beetroot juice and it relaxes the endothelial lining, it causes vasodilation, the heart is able to push it through easier, and so the heart does not have to work as hard, and so the blood pressure goes down. So that is the mechanism of how beetroot juice lowers your blood pressure. Let's see, one other thing you do. What else do you do? Well, we'll come back to it, but yes, for those of you who are having issues with liver, kidney, pancreas, pancreatitis, those of you who are suffering from acute or chronic pancreatitis, you eat something and you're always nauseous, or your pancreas, which is on this side, begins to hurt. Your liver is on this side, by the way. So every time you eat something sweet, this will help heal the pancreas as well. So this thing takes care of pretty much all of your organs that you would have an issue with. All right, so looks like we've got another caller here. All right, Betsy, welcome to Pharmacist on Call. How may we help you?
Yes, I have a question. How do you spell this medicine that you're talking about?
Oh, the beetroot juice. It is B-E-E-T.
R-O-O-T?
Uh-huh. So this is juice from the root of an organic beet. So it's beetroot juice.
Okay, I've never heard of it. So where is it? Where do I get it? At any pharmacist?
I doubt it. Pruitt's Discount Pharmacy in Nashville, Tennessee.
All right, so where is that in Nashville? I don't live in Nashville.
We are about a mile and a half from Titan Stadium. We're right there on North First. It transitions into Dickerson Road. So we're at 811 Dickerson Pike, and the producer will flash our location at the end of the show there. So make sure you hang on and watch so that you can find out exactly where we are.
811 Gibson's Pike.
Dickerson, D-I-C-K.
I got it.
E-R-S-O-N. Or you can just talk into your phone and say Pruitt's Discount Pharmacy, and it'll bring you right to us.
Is this a new thing, the beetroot?
No, ma'am. No. Beet's probably thousands of years old, but in terms of using it, I've been recommending it to my patients for the 5 years that we've been open.
And all of them have seen all these changes?
Yes, ma'am. We've even had some call in the show and give us their testimonies. Yes, ma'am.
Well, I will call back if this works.
Yes, ma'am. You'll be calling back then.
All right, listen, thank you so much.
Yes,
appreciate your time.
All right, thank you.
Bye-bye.
All right, bye-bye. All right, everyone, we're up on a break. Stay on those lines. They're heating up. We'll be right back.
This is a Storm